Narcissism, a term frequently tossed around in both clinical and casual conversations, often conjures images of self-centered, attention-seeking individuals. However, the spectrum of narcissistic behavior is broad and multifaceted, making it crucial to distinguish between its various forms, particularly malignant and covert narcissism. Understanding these types can lead to better handling of personal and professional interactions. Narcissism stems from the Greek myth of Narcissus, who fell in love with his own reflection. In psychological terms, it refers to a personality disorder characterized by an inflated sense of self-importance and a deep need for excessive attention and admiration. While some degree of narcissism is present in many individuals, pathological narcissism can disrupt lives and damage relationships. Common traits include grandiosity, a lack of empathy, and a robust sense of entitlement. Recognizing these traits is the first step in managing relationships with narcissists effectively. Malignant narcissism is considered one of the most extreme and damaging forms of narcissism. This subtype goes beyond the typical narcissistic traits to include elements of aggression, sadism, and paranoia. Unlike their counterparts, malignant narcissists are often aware of their manipulation and take pleasure in the destruction they wreak. Psychologically, this form of narcissism can be linked to severe disturbances in early developmental stages. Malignant narcissists often display behaviors that are not only toxic but also dangerous, setting them apart from other narcissistic behavior patterns. Malignant narcissists exhibit a range of disturbing traits. Their aggressiveness can manifest as outright hostility or subtle psychological manipulation. They often employ complex strategies to dominate others, including gaslighting and scapegoating. Their lack of empathy is profound, allowing them to harm others without remorse. Grandiosity in malignant narcissists is particularly acute, with fantasies of unlimited success and power. Real-world examples, such as certain dictatorial leaders, vividly illustrate these traits. Covert narcissists, by contrast, present a facade of modesty or even self-effacement, but underneath lies a strong sense of superiority and entitlement. They are less obvious in their narcissism, making them harder to detect and often more insidious in their manipulation. Psychologically, covert narcissism may stem from insecurities and unmet childhood needs. Unlike overt narcissists, their grandiosity is more internalized, leading to resentment and passive-aggressive behavior rather than blatant displays of dominance. Covert narcissists are hypersensitive to criticism, often reacting with withdrawal or sullen anger rather than overt aggression. Their passive aggressiveness is a key weapon, used to subtly undermine and control those around them. Despite their outward appearance of insecurity, covert narcissists harbor a deep-seated belief in their superiority. This contradiction creates a complex interplay of behaviors that can be confusing to their partners and colleagues. Examples from clinical case studies help illustrate these dynamics. While both malignant and covert narcissists share the core elements of narcissistic personality disorder, their outward behaviors and internal motivations vary significantly. This comparative analysis sheds light on their different impacts on relationships, highlighting how each type might manipulate or damage their interpersonal connections differently. Understanding these distinctions is crucial for navigating the complex landscape of narcissistic interactions, whether in personal relationships or broader social contexts. From a psychoanalytic perspective, narcissism is often seen as a defense mechanism against deep-seated feelings of inadequacy. Cognitive behavioral approaches, on the other hand, focus on the maladaptive thought patterns that reinforce narcissistic behaviors. Integrating these perspectives provides a more comprehensive understanding of why narcissists behave the way they do, offering insights into potential interventions and therapies. The impact of malignant and covert narcissism on relationships can be profound and destructive. In romantic relationships, these personalities may lead to toxic dynamics characterized by manipulation, abuse, and emotional detachment. In familial settings, narcissistic parents can create an environment of insecurity and competition, while in the workplace, narcissistic individuals may foster a culture of fear and low morale. Understanding these impacts can help in developing strategies to mitigate their negative effects. Interacting with malignant narcissists requires strong boundaries and often strategies to minimize harm. It's advisable to avoid direct confrontation and to engage in minimal necessary contact. Seeking professional guidance can also be crucial in handling interactions with malignant narcissists, especially in scenarios where escape or complete disengagement is not feasible. Covert narcissists require a different approach. Effective communication and clear boundaries are essential. Techniques such as setting firm limits and engaging in consistent non-emotional responses can help manage the relationship. Self-care and external support are also vital, as dealing with covert narcissists can be an emotionally draining experience. Understanding the nuanced differences between malignant and covert narcissism not only enriches our psychological insights, but also empowers us to handle interactions with such personalities more effectively. By recognizing their distinct traits and adapting our strategies accordingly, we can protect our well-being and foster healthier relationships, even in the face of such challenging personalities. The dissection of these two forms of narcissism provides a roadmap for navigating the complex interactions and relationships affected by such behaviors, emphasizing the importance of awareness, understanding, and strategic handling in maintaining one's mental health and emotional balance. In the panorama of human behavior, narcissism stands as a beguiling paradox, both alluring and perilous.